if you've ever had a bill from an insurance company and it was just way out of proportion to what you thought it should have cost, this video is for you. So basically, I have some insider tips on what things actually cost, especially in the primary care world, and I'm just going to share those with you. So number one is office visits for doctor services. Basically, every clinic's going to have a cash pay price. There are some specialty clinics that don't give you cash pay pricing, and that's a little odd to me. Like, you have to have insurance no matter what to go there, but that's on them. But in general, for primary care, you will spend maybe $150 to $200 per visit, sometimes less, to see the doctor. There's an argument for direct primary care membership because you're going to get the same doctor almost every time, or same couple of doctors. And for a year's worth of primary care, you'll spend less than $1,000 for the membership there. So that's what my membership is. In general, it's less than $1,000. It's a little bit closer to $1,000 if you're over the age of 65, but that's because people who are older generally have more problems and we tend to spend more time with them. But kids are even less. Kids, you can get away with $300-400 or less for the year. And we pay month to month. So basically, if you have a membership at our clinic, you're going to take that, $800 and spread it out over 12 months, and you know exactly what you're paying. We don't charge copays, deductibles, or anything to do with insurance because I don't have any contracts with insurance. I actually had to opt out of using insurance, meaning I had to send a letter to our state's Medicare and say I will not be using you guys, so bye. And it just keeps things really easy for me. Any insurance-based doctor that you do see will have a signed contract with that insurance that allows them to bill that insurance for their services. Basically, they're working for the insurance company when you think about it that way, whereas I'm working for my patients, which I think is better. So that's how you could save on office visits. Every office should have a cash pay price. So think about it. If you tend to have like a high deductible or copay with your visits, you can think about that. Where you really can save some money is through things like labs, radiology, and medicine. So being a self-pay doctor, I have a lot of knowledge about what things cost. I'm going to start with labs. So basically, when you get like your annual labs, which for me, that's blood counts, cholesterol, I'll do a thyroid screening test, a chemistry panel, like your blood sugar, your kidney and liver function, your electrolytes, sometimes a hemoglobin A1C. A lot of people like to know that, especially if you're diabetic, you're going to have to know that. But you can get away with all of those labs for about $30. And when I found that out, I was pretty impressed. And even over the 5 years that I've been doing self-pay medicine, that price really hasn't changed much, even with inflation. So every direct primary care or self-pay clinic will have or should have some sort of negotiated prices with a lab. And so we have really good negotiated prices with LabCorp here in Arizona. And so that's what things cost. A lot of the time people are asking for more complicated labs like vitamins, like vitamin D, for example, will cost you $20. A hormone panel might cost you $75. So there are pricier labs out there, but they're still not that bad, really. In fact, I actually had a patient who I needed to see if she had an infection. So I really only wanted 2 labs, and those are simple labs. And she got the bill when she paid at the desk. We don't send bills home later. You pay just right then and there. So to keep it simple, right? So this is somebody that I know outside of the clinic too. And she was like, did you give me like a discount on my labs because I know you? Because I got the bill and it was like $6 and $7. And I was like, no, actually, I didn't give you a discount. In fact, I use the phrase that I like to say often is that friends let friends pay full price, which is just I think it's a funny joke, but it's kind of true, right? So anyway, she was really pleased with that. And she said, I might as well just keep you even if I do get insurance. I was like, well, thanks. That's exactly what I want to hear. So labs don't tend to be that expensive. I actually got a bill for a lab that my son had done a couple weeks ago, and the bill is $196. Whereas if I would have self-paid that, it would have been $75. So it's just the more the better. Another thing you can save quite a bit of money on is radiology. So X-rays, CTs, MRIs, ultrasounds. Out of all of those, ultrasounds kind of get me a little bit on what they cost, but I'll give you an example of the prices that I know locally here. So for a self-pay X-ray, you're going to spend about 40, maybe $50. For a CT, around $200 to $300. For an MRI, $300 to $400. People are pretty shocked when they hear that. They usually think an MRI is going to cost about $1,500. And when I tell them the real cost of it, it usually removes a barrier to them getting what they need done, right? So that I can see what's going on so that I can help them better. And then medicines. Medicines is kind of the last piece of the puzzle. I have an in-house pharmacy. We can do that in Arizona. You can dispense from your office if you follow the right protocols. Not every state has that, but we buy wholesale medications and sell them directly to you. I just really like being able to give you an antibiotic if I prescribed it that day, so you can go home with it and there's no, gosh, I hate, being called the next day saying I couldn't get that med at the pharmacy because they didn't have it, or my insurance didn't cover it yet, or whatever. So I'll tell you, for example, antibiotics, especially from my clinic, they tend to cost about $7 or $8 for a week's supply of an antibiotic. One of the more expensive medicines that I know of is like an antiviral medicine, and it is about $20 or $30 for a week's supply at my clinic, whereas at the pharmacy it's usually about $70 or $80. So there's a lot of empowerment in knowing what things cost for self-pay, for cash, versus using your insurance. Insurance, I don't really understand it, but they've got a lot of markup going on and can be really confusing. So I just want you to know that there are better options. And if you're ever curious about direct primary care or self-pay medicine, put a comment in, hit me up. And if you're a doctor in the insurance world and want to get out of it, consider looking me up, talking. We're always hiring for direct primary care. You guys have a good day.